Seeking the blessings of the divine, offering our salutations to Sadhguru Sri Madhusudan Sai, dignitaries on the dais, off the dais, leaders from the healthcare sector who have gathered here, members of the media, those watching us live from around the world, staff and students, and those joining us from the various medical colleges from the district of Chikbalapur. Welcome to the inaugural session of the National Conclave on Good Governance in Healthcare for Global Welfare, jointly organized by the United Nations Global Compact Network India, Prashanti Balamandira Trust, and the Sri Madhusudan Sai Institute of Medical Sciences and Research. The word governance has its origin in the Latin word, it's said, called gubernare, which means to rule or to steer. So governance, it is said, is about steering an organization in the right direction. Today, organizations and societies face complex ethical challenges on a daily basis around the world, and collective action is a key approach to slowing the scale of this issue, thereby contributing to Sustainable Development Goal number 17, which is for partnerships and the goals. Thus, multi-stakeholder partnerships are indispensable in order to effectively tackle and solve the perennial sustainable development problems outlined under good health and well-being in Sustainable Development Goal number 3, and for peace, justice, and strong institutions as outlined in Sustainable Development Goal number 16. Accordingly, transparency, ethics, and openness are the pillars of good governance. We will commence today's proceedings with the ceremonial lighting of the lamp, and may we please invite our dignitaries for the same.
Asato ma sadgamaya tamaso ma jyotirgamaya mrityorma amritangamaya. Om Shanti Shanti Shanti.
We take this opportunity to welcome our dignitaries on the dais, our guest of honor, Dr. Subramanya Kusnur, founder, chairman, and CEO, Aquacraft Group Ventures, which is an innovation-driven, next-generation sustainability and impact group that creates actionable solutions to drive improvements in sanitation, clean drinking water, public health, and hygiene across India. Shri Ratnesh Jha, Executive Director, United Nations Global Compact Network India. Dr. Somnath Singh, Deputy Director, United Nations Global Compact Network India. Dr. C. Srinivas, Chairman of the Global Chain of the Sri Sathya Sai Sanjeevani Hospitals. Shri B.N. Narasimhamurthy, Chancellor, Sri Sathya Sai University for Human Excellence. Dr. Raghupati, Director, Sri Madhusudan Sai Institute of Medical Sciences and Research. And Sadhguru Sri Madhusudan Sai, the goalpost, the guidance, the chairperson, Prashanti Balamandira Trust, founder, Sri Madhusudan Sai Institute of Medical Sciences and Research, a visionary, a humanitarian, engaged in transforming millions of lives through free nutrition, free education, and free healthcare across 33 countries every single day. Today, we're all gathered here this morning to foster a kind of collective action to strengthen transparency, accountability, and also to devise strategies to combat corruption and improve good governance in the healthcare sector. But for a moment, if we were to step back, what do we see around us? We see a lot of materialism, which is spread like wildfire. People are competing in this mad rat race for satiating their needs. Well, there's no harm in that. But as long as it does not lead to a decay in moral standards, and sadly, this is the most frightening change the world has seen. Globalization has imposed and established rules which benefit a few. There is a huge gap between the haves and the have-nots. And today, through the panel discussion and the multi-stakeholder workshop, we will deliberate not only about the importance of stakeholder involvement in addressing healthcare challenges, the responsibility of multi-stakeholders in promoting transparency, governance and accountability in healthcare, good practices and innovative approaches, and the role of compliance as an anti-corruption measure in the healthcare sector. But we will also discuss the need for students to turn out into noble and able personalities who will build sustainable societies based on transformative action which will benefit the most needy in the society. We will now have a short video on the United Nations Global Compact Network India, which will talk about the work being done by the Compact in India specifically. Can we have the video, please?
We need a world where all strive to progress and prosper together, and no one is left behind. In September 2015, around 193 countries of the UN General Assembly came together for world's largest corporate sustainability initiative 2030, Agenda for Sustainable Development, with 17 Sustainable Development Goals, or SDGs. With these new goals that universally apply to all, countries would mobilize efforts to end all forms of poverty, fight inequalities, and tackle climate change. The cost of implementing SDGs is a staggering $5 trillion per year. On the other hand, business leaders and entrepreneurs can unlock market opportunities worth $5 trillion and generate 230 million jobs in Asia alone through sustainable business models. In India, this mammoth task is taken forward by Global Compact Network India, GCNI, local network of the UN Global Compact. Though GCNI saw a very humble start, but as the time progressed, this revolutionary movement and phenomenon paced up with thoughtful members as new partnerships and collaboration came up by every passing day to support and strengthen this one family. Today, by global community, completely reflects the development agenda of India.
भारत ने विकास का जो मार्ग चुना है, उसके और यूएन द्वारा प्रस्तावित सस्टेनेबल डेवलपमेंट गोल्स के बीच बहुत सारी समानताएं हैं.
Many programs are launched by the government to make progress towards these global goals. Pradhan Mantri Jan Dhan Yojana ensures access to financial services in an affordable manner. Midday meal scheme is designed to improve the nutritional status of school-age children nationwide. Pradhan Mantri Swasthya Sanrakshan Yojana provides reliable tertiary healthcare services. Sarva Shiksha Abhiyan ensures education for all. Beti Bachao Beti Padhao focuses on gender equality and empowerment of girl child. All these initiatives, schemes and programs are broadening the horizon for India's growth and transformation, creating new pathways for protection of people, planet and prosperity across the globe. DCNI is working hand in hand with Government of India in taking this agenda forward with its several initiatives, which include programmatic interventions, research, training and capacity building, advocacy, promoting governance, awareness and recognition. Though we have come a long way, but still there is much more to conquer, much to re-establish, much to reform and much to impact. Many more lives to be touched to make our country and our planet a better place to live in future. Because future is not just your or mine. Future is ours. And it's our responsibility and duty to shape up a sustainable future together. With responsible business practices combined with collaboration and innovation, we can bring about powerful change in markets as well as societies, proving that profit and principles go hand in hand. Let's shape a sustainable future together. Come, join us, become a member today and show the world that India can make a difference.
I am really happy that this is the opportunity for me, that we are very much committed for the welfare of the world society. The Happy Human Index is the most important thing for all of the stakeholders. It is the time with the collective team spirit and with creating cooperation, coordination and communication between the all stakeholders to achieve this goal is the most important agenda for the world.
As the father of the nation in India, Mahatma Gandhi said, "You must be the change you wish to see in the world." Global Compact Network India has been a force for responsible, sustainable change since 2001. Let us work together strategically to not only continue, but to accelerate our work on the SDGs. The UN Global Compact is here to work with you side by side, uniting business for the better world that we wish to see. Thank you.
We would now like to invite Mr. Ratnesh Jha, Executive Director, UNGCI, to deliver the introductory remarks and set the context for today. Mr. Ratnesh Jha has more than 3 decades-long experience at the national, state, and district levels in designing, financing, implementing, and evaluating development interventions to reach out to unreached social groups in challenging geographies in India. His domain expertise includes financial inclusion, enterprise promotion and development, poverty alleviation, women empowerment, and inclusive growth. He has provided technical assistance to the Ministry of Finance, Micro, Small and Medium Enterprises, Ministry of Rural Development, and Niti Aayog, Government of India, as well as social sector departments in UN-focused states. He joins UNGCNI from India's leading think tank on public finance, the National Institute of Public Finance and Policy, where he worked as a senior fellow. Mr. Ratnesh Jha.
Thank you, Bhuvna, for that warm introduction. And also, my job has been simplified. You saw that excellent clip that we had produced. So, broad introduction is over. Dignitaries on the dais and my fellows who have come for this very important consultation. Bhuvna has set the context. So, as you are all aware from the introductory clip, UN Global Compact is a global network of businesses with a human face, We are not about audit, we are not about measurement, we are about trusting each other and forming a community of like-minded global corporate citizens. All the top civil society organizations, academic institutions, as well as the corporate members are forging together hand in hand to achieve these sustainable goals. And it all begins with a declaration that we believe and practice the 10 universal principles that UN Global Compact espouses, which are in the area of human rights, labor standards, anti-corruption, as well as environment protection. All of it are reflected in this August gathering. All of you young citizens of the world who are being trained in the skills and pedagogy which is suited for the new world, adhering to the diversity and the richness of Indian tradition, as well as the equipping you to address the major challenges that we are going to face. And this is in essence what UN Global Compact also strives to do. So when we received this request from this institution, we were very happy because it was a win-win partnership for both of us, because our goals are similar, our methods of achieving them are also pure, and we would like this partnership to grow so that we are able to cover more and more we are able to cover more and more people who have not been able to be reached by the schemes that Government of India has initiated, launched. So we at UN Global Compact take this pledge every day to do something in an innovative, in a disruptive way, so that we are able to break the barriers, break the boundaries, and reduce the struggle, reduce the problems that is faced. And all these SDGs, 17 goals, if you look at it, you must be aware of it. We have all the nations of the world have adopted in 2015, September 2015, and we are standing at the midway. And all the progress that we achieved, some of it was, we had to backtrack because of two very critical global events. One was the corona pandemic that we all faced, that took away 2 years from our lives because we were confined in our own homes. The protection, the survival was the main issue. And then second, the ongoing war that is happening between Russia and Ukraine, where all the global energy equations, all the supply chains, all the efforts at global market integration, they have all suffered huge setback. And this all has a domino effect on all the sectors, and ultimately it's the poor and the marginalized who has to bear the brunt in any disruption. So the domino effect ultimately stops there. So that makes our work more challenging, and we are not afraid of it. We just have to be more prepared. And as everyone in this hall is aware of the good work that this organization is doing, this trust is doing, we together now will expand our area of and horizon of influence. We will learn from each other, we will contribute to each other, and how better and how best to address the daunting problems which we are faced with today in the state, in the country, and globally. So that is my message here. I come here, and first and very important thing that we are going to do today after this inaugural session is we are going to have a panel discussion on how global goals related to health can be solved if we all the stakeholders decide to work together and bring about change in the way we operate, and the whole ethical, the whole governance and the whole transparency issues, the challenges faced by us, and how your trust has been able to overcome most of them. We are here to learn, and whatever we learn today, we are going to try to disseminate it through our similar events that we keep holding across the country. So thank you so much for coming in such large numbers. Thank you.
Now like to invite Dr. C. Srinivas, Chairman of the Sri Sathya Sai Sanjeevani Hospitals, to deliver the theme address. An exemplar of service and perseverance, Dr. C. Srinivas has helped deliver free healthcare to hundreds of thousands of people in India over the course of 4 decades of service. After having been closely associated with Sri Sathya Sai Baba and his various service projects in healthcare, education, and drinking water supply for over 40 years, he is spearheading the establishing and the management of the Sri Sathya Sai Sanjeevani Centers for Child Heart Care globally, which is the world's largest chain of pediatric cardiac hospitals, providing totally free of cost treatment to children born with congenital heart disease. Dr. C. Srinivas.
Most revered, beloved Sadhguru Madhusudan Sai, distinguished representatives of the UN body, distinguished ladies and gentlemen, many healthcare givers and practitioners, students of medicine, and other students of the Sathya Sai institutions, sisters and brothers. When you visit any country, you go as a visitor or a tourist. But you visit India only and only as a pilgrim. These profound words of Martin Luther King form the platform and the foundation for today's august meet. When we come to India, when we live in India, essentially, life is a pilgrimage. All life is reverential, said Albert Schweitzer, a Nobel Peace Prize, a Nobel Medicine Prize winner many, many decades ago. In the Sathya Sai institutions and what will be taught at the Madhusudan Sai Institute of Medical Sciences is the timeless cardinal virtue that life has to be lived as seva. Whichever act that we engage in, that it has to be an act of seva would define whatever we do and who we are. This is most true through the practice of medicine or the delivery of health care. One was told that this is a meet that will delve into the important aspect of governance, especially in the domain of healthcare. Governance goes back to remembering the great Indian king, King Bharata. King Bharata was the embodiment of proper, righteous, and exemplar governance. Bharata was the brother of Lord Rama. And one has drawn daily inspiration of governance from the great King Bharata. And what was that? When Rama was in exile and Bharata became emperor and king, did he sit on a throne? He sat at the feet of the Padukas given by Lord Grama. To me, my 50 years in public life, that has been an inspiration and a practice I have tried to live by. Healthcare cannot end as a transaction. Healthcare has to end as a transformation. Healthcare transforms both the caregiver and the care receiver. The amount of good that is done to those who are sick and in need by those who are blessed with the knowledge of giving medical support and succor is not a transactional exercise, but a transformative experience. The joy, the happiness, and the well-being and wellness you offer through the delivery of healthcare is a life's pursuit and a definition of the meaning and purpose of one's life. So if governance is governed by the goal that life and the delivery of healthcare is not a transaction, but a transformation, you will see a magical difference in the way you become a doctor and the way you practice healthcare. I leave you with a small thought because we have institutions in several unserved geographies of this country. When you take healthcare as a seva, and when you keep the goal of healthcare as transformation, there is not performance, but outperformance. You will see that you perform beyond yourself because you are representing a cause, you are representing a great purpose. The conglomerate of the United Nations is an entity not to bring a transaction, but a transformation. And what greater and what nobler place to learn, to imbibe and gather this than this holy presence. If Luther King said, coming to India was a pilgrimage, you are at the holiest of holy here in Muddenahalli. So may this conclave and may this meet teach us that life and the furtherance of healthcare should lead and end in transformation and not in transaction. God bless this beautiful conclave.
We're very blessed this morning to have our guest of honor, Dr. Subramanya Kusnur, with us, who is known for his business philosophy, which is service to the nation and mankind. He has successfully spearheaded a movement that has leveraged innovation, advocacy, entrepreneurship, sustainability, and capacity building. He has relentlessly worked in the field of water, promoting green and energy-efficient solutions, invested over 5,000 days, traveled over 7,000 villages and 1 million miles, contributing his might to help India achieve its dream of giving the right to water to every citizen. Aquacraft has till date harvested and treated over 9 billion liters of water across 9 states of India, and Aquacraft was recognized as the Water Sustainability Partner of Sri Lanka. Dr. Subramanya Kusnur is also the treasurer of the Governing Council of the United Nations Global Compact Network India and has been recently appointed as the consultant to the Ministry of Water Supply, Government of Sri Lanka. May we please invite you for your special address, sir, this morning.
Revered Madhusudan Saiji, it's a privilege, honor, and a blessing to stand here today and humbly contribute my experience after stalwarts who have talked about healthcare. But I'll just share a bit of what we've been doing and what we can do together at the Global Compact. So I'll speak in the capacity of a member of the Governing Council of the Global Compact, as well as what we try to do in terms of water and sanitation. Thank you very much for this opportunity. I'm grateful to Ratnesh ji, Somnath ji, and Deep for getting me here today. Very grateful to speak to all your audience, and I see many of them are budding healthcare professionals. We've been in the business of water and sanitation for over 14 years today, and we strongly feel that water and sanitation have a direct impact on public health, both on communicable diseases as well as non-communicable diseases. Bacteria is the biggest killer as far as communicable diseases are concerned. And heavy metals in the ground, which is the only source for 80% of the country for drinking water, like arsenic, fluoride, iron, are the cause for chronic diseases, which eventually have a huge impact on public health overall. Why we delved across this entire problem, we thought it is important for us to look at sustainability in what we deliver. Sustainability has got a very different conundrum, because sustainability doesn't come by science, it doesn't come by technology, but it only comes by empathy. And this is one of the key elements which I'm very, very grateful to see what is happening, and I'll talk about the healthcare after that. So while we talk about sustainability, it's important for us to have the community involved in that. And as Sir rightly talked about Seva, and that is one of the critical transformational elements where human empathy, human service that can be integrated with best practices, technologies, and solutions is essentially our formula of sustainability, which we have achieved after a lot of challenges, tribulations, and sort of roadblocks that we faced in the initial stages. What we provide right now is we provide clean water, which is filtered on gravity. It doesn't require any electricity, and it doesn't waste water. Similarly, one of the key things we saw was sanitation as the biggest challenge, not just for everybody, and particularly for women. That's when we built a biodigester, which essentially doesn't require water to treat the fecal matter, which eventually gets converted to liquid fertilizer. I'm not trying to tell or promote what we are trying to do, but the idea here to all you young people and your budding professionals who are coming across is that we are talking about governance in healthcare. And governance in healthcare has two basic paradigms. One is a $1 trillion industry that is buzzing. Another is a completely empathy-oriented activity, more impactful, which is done under your grace. So when we are talking about two separate activities, one sector is focused purely on building value through financial and fiduciary means, whereas the other activity, which is being innovated by His Grace, is essentially talking about delivering healthcare, the best of healthcare, at absolutely no cost. So how do you bridge the gap between both these things? The idea is to build more and more professionals and more healthcare professionals. And as Sir rightly said, you all are more transformation agents rather than transaction agents. The whole idea of managing malpractices and governance is that each one of you medical professional has to be a self-regulator by yourself. And your elements of regulation are one are, of course, healthcare, which is the standard activity. And another thing is compassion and empathy. I'll just share a classic example of my father, who suffered a severe paralytic stroke in 1979, and his right-hand side was fully paralyzed. He survived 32 years for that. His only activity was that every morning he would see a doctor who would tell him, "You'll be good." After his attack, he survived 10 years, served Reserve Bank of India where he was working, and subsequently had a life which was absolutely like everybody else. What I'm trying to say is, a doctor, your presence and your empathy and your compassion and your element of doing good without expecting anything is 80% of the cure. This is my experience. I may be wrong. And when COVID hit the entire country, we had a big challenge in Mumbai. All the help, house help, maids, drivers, used to come from slum areas. Mumbai has got the biggest slums in the world. And we had a challenge to see how we could survive. First 15, 20 days was okay, but then eventually it became a problem. That's when a doctor approached me, an MBBS doctor. She says, "Sir, can we do something together?" That's when we built a concept of a gully clinic in a slum. And we started aggregating social doctors. who would otherwise do their normal profession during the day, and they will invest 10 hours every month with us. So this is how Gully Clinic blossomed, and today we are impacting over 500,000 people in 6 Gully clinics across 6 slums in Mumbai. And it's very, very affordable. They get a family card for 100 rupees, which they can use for 3 months for 4 visits. And then we have specialist doctors who come and contribute their time. So we have people across cardiology, dermatology, nephrology, everybody. So essentially what we are trying to say is that there is always a model to serve the humanity. Most important thing, as His Grace has, is the intent to serve. To serve the underserved is one of the most important elements of sustainability. That is what we have learned in life. Doing all these activities together, you still have to battle with a huge corporate industry, which has got an equal responsibility and a contribution. Now, today's debate and today's discussion should be focused around how we all together can put our minds together. And the younger generation is something which we want to listen to more. You have a lot of ideas, you have a lot of out-of-box minds, you have got more access to technology, more access to information. How we can aggregate all these things together and build the healthcare services that has been done under this institution as an epitome and a model to not just be evaluated, but be benchmarked and proliferated across everywhere. We are 1.3 billion people in the country today. Normal healthcare activities and good hospitals and government hospitals have got limited scope to play. The government is doing a fantastic job, but government cannot do everything. As our beloved Honorable Prime Minister, Shri Narendra Modi ji says, it's all about Jan Bhagidari. Collaboration and partnerships across all stakeholders in addressing a particular objective is something which I strongly feel with the kind of, the drive here, the kind of strength here, I think we'll be able to achieve that. I'll not talk much about it, but rather hear from all of you all. And together, let's take this model as a benchmark and an epitome, and under your grace, try and build it further and make it more impactful. And under SDG 3, I will talk to Ratnesh and our governing council if we can make this as a model and talk about it and proliferate. God bless. Jai Hind.
We will now have the inaugural address by Sadhguru Sri Madhusudan Sai, who spearheads a unique global mission across 33 countries. Since 2011, Sri Madhusudan Sai has established institutes of excellence in education, healthcare, nutrition, and spirituality across the world. 27 educational campuses, a university in South India, and 3 institutions abroad in Nigeria, Laos, and Australia are providing free values-based education to over 5,000 boys and girls. At Sathya Sai Grama here in Muddenahalli, which is also the epicenter for all the global service initiatives, a totally free 360-bedded multi-specialty hospital treats over 1,200 patients every day and is also the teaching hospital for India's first free medical college, the Sri Madhusudan Sai Institute of Medical Sciences and Research, which was inaugurated by the Honorable Prime Minister of India, Shri Narendra Modi, just a few months ago. Guided by the vision, in rural, for rural, this first of its kind medical college shall nurture medical doctors with ability, nobility, and stability, who shall dedicate themselves to serve the underserved, particularly in rural India, where their need is the most. Today, 10 specialty hospitals in India, 3 hospitals abroad in Fiji, Sri Lanka, and Nigeria, and a medical center at Clarksdale, Mississippi, USA, are providing free healthcare every single day. Over 25,000 pediatric cardiac surgeries have been performed free since its inception in 2012. A morning nutrition program nourishes 3 million school-going children every day in India and across 5 countries. All these services are offered absolutely free of cost to all without any discrimination. 12 centers for human development in 11 countries have also been established to work towards the welfare and well-being of all as one global family. Thus, several lives are being illumined by these benevolent acts of goodness every day, spearheaded and steered by Sadhguru Shri Madhusudan Sai. May we please invite him to deliver the inaugural address.
सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखम् आप्नुयात्. May all be healthy, may all be happy, may no one have any sorrow, may everybody see auspiciousness everywhere. This is an old Indian prayer. And I think this is the essence of all the sustainable development goals that United Nations and its partner organizations are attempting to have. Everybody, when we say it means everyone. That includes bees, birds, the environment, the rivers, the mountains, and not just human beings across several continents and countries. This prayer has been there as the backbone of Indian culture from time immemorial. And several kings, as our Dr. Srinivas was mentioning, have guided people to follow this path through their own example. And India, being such an ancient civilization, has always been the leading light for the world. And today, in this place, it's a sacred place because it is sacred due to the selfless service of so many people who are dedicated workers, volunteers, doctors, teachers, and other partners who are working day and night for the welfare of all, selflessly. That's why this place is sacred. And here, having a conclave like this, of not just national but global importance, with the United Nations Global Compact Network of India, which is working towards achieving these sustainable development goals for the people of India or the global south, as Mr. Ratnesh Jha was mentioning to me. So I'm very glad to have this association on behalf of the university and the medical college. I convey our gratitude and heartfelt thanks to Mr. Ratnesh Jha for organizing this. So also Mr. Somnath Singh, Dr. Subramaniam for coming over here and sharing his valuable inputs. And also we have on the dais the Chancellor of the University, Sri Narasimhamurthy, Director of our hospitals, Shri Dr. Srinivas, and Director of the Medical College, Dr. Raghupati. To all of them, I think I would repeat what Dr. Subramaniam just said. All change begins from this intention to serve, the intention to make the change. And that begins with empathy. And what a wonderful word empathy is. When we prayed, Sarve Bhavantu Sukhinaha, let everybody be happy, it is not an empty prayer that you make in the morning and then forget by evening. Sympathy can be lip service, but empathy demands action. You can't just say I am empathetic towards somebody and you not do anything about it. And that is the principle of Bhagavan Sri Sathya Sai Baba, who taught us love all, serve all. That's etched in the back of the hall. And it is a constant reminder and the guiding principle for all the actions that we undertake. Love all is empathy, and serve all is the action that follows that empathy. So when we love people, we naturally end up serving them. We can't just see them suffer and do nothing about it if it is in our might. And one suffering that we all have had in common is some issue related to healthcare. I cannot think of anybody in this world who never had a health issue and who never had to see a doctor. I mean, you will be perhaps somebody who is yet to be born. But for most of us, we have been to healthcare systems, we have been to doctors, we have been to institutions which deliver healthcare, and we have had our own kind of experiences in different places through different people. When we talk about good governance, we talk about good people at the helm of affairs. When we talk of good people at the helm of affairs, we talk about good education that they have been imparted with. When we talk of good education, that the people at helm of affairs who carry on good governance must have had, then we talk about good institutions that have imparted such good education. And we talk about such good institutions in the first place, we again talk about good governance. So it's a cycle. And where do we begin? Where do we start making a change? I felt that the change should be made at the institutional level. When we have good institutions that produce good people with moral fabric, with ethical backbone, they are definitely going to do good governance wherever they go. And healthcare being such an important aspect of our lives. Everything else is not a matter of life and death, but healthcare is. And if there is no life, there is no world, there is nothing to do over here. So unless healthcare is governed correctly, and with good governance, we just don't mean best industry practices or auditable and accountable financial stable organizations or any of these other norms of governance, but we talk about a governance that can deliver healthcare to the most needy in the most affordable, accessible, and acceptable way. When I was listening to the video which was being played, they were talking about solutions to the global problems that they are working on with the United Nations. Though we have global problems, but they have local solutions. And healthcare is one such area where there has to be a local solution to this global problem. Every country is different, their culture is different, how people approach healthcare is different, their expectations from healthcare institutions are also different. And since we run so many healthcare institutions across the world, it is, though a global issue, still it has a lot of local implications. How the doctor speaks to the patient, in what language, with what kind of words that the doctor uses, the bedside manners as they talk about. All these affects the total quality of healthcare delivery. And governance must address this as well. And when we talk about that, we talk about good people, good medical graduates, postgraduates, specialists, and all other healthcare professionals who may not be medical but even non-medical staff, which is a part of a healthcare delivery system. They all are a part of good governance. And so as an effort to deliver good governance, we thought of building this medical school, which will give an opportunity to those who are passionate about serving the society through healthcare, through medicine. We must give them an opportunity. As you know, there are probably now almost 18 to 20 lakh children who write NEET exams in India. Half of them almost qualify, but the seats are just 1/10 of the qualified numbers. And then there is a demand and supply gap, and good governance has gone out of the window. Because when there is a huge mismatch between demand and supply, governance cannot happen over there. Corruption happens over there. And this topic of this healthcare conclave, as Ratnesh Jhaji and everybody had recommended, corruption-free, good governance, healthcare system. I think it begins with making healthcare education available, accessible to the passionate people who want to become doctors and serve the society. It all begins from there. If healthcare education is very expensive and is unaffordable and inaccessible, then governance, good governance in the hospitals and healthcare systems cannot happen. So we cannot make every hospital free. That's not possible. As when Mr. Subramaniam said, there are models, and everybody has to pick and choose their model of healthcare delivery. Everything cannot be just as we do. There are many other ways. Government has its own ways, so also other non-profits have their own ways. We are a totally free institutions. We have our own model of doing things. We need several of us to work together and do the same thing in different ways, but achieve the same goal at the end, which is to deliver healthcare in a proper way, in the most appropriate way to the needy. And the effort should be that nobody who needs healthcare should be turned away for the want of finances, for the want of professionals, for the want of infrastructure, for connectivity, or for any other cause. That should not be the way healthcare delivery should happen in our country or anywhere in the world. Anybody who needs healthcare services deserves that healthcare service. And to deliver it is the collective responsibility of all the organizations, starting from the United Nations to the governments, to civic bodies, to corporates, as this is the corporate network, to NGOs like us, and to any other organizations, faith-based, cooperatives. All kinds of healthcare systems must walk the talk, must come together in order to deliver healthcare to the doorsteps of the needy in the most affordable, accessible, and as I said, acceptable way, because they have their own understanding and expectations, and it has to be modified and customized to their needs. India has always led the world when it came to goodness. Dharma. Dharmo rakshati rakshitaha is an old adage which says the one who protects dharma is protected by dharma. And time is a witness to so many corporations, organizations and governments which have had a steep fall after a steep rise because of lack of dharma. And governance in Indian terms is dharma. Doing what is right is governance. And doing what is right is to make sure that healthcare is not made into such a business that it becomes out of reach for the common man. And that's where the good governance should start addressing the healthcare problems. And I'm not saying everything has to be free as we do. May not be possible everywhere all the time. Maybe in some pockets, in some sections. But cannot be a business at least to begin with. It cannot be a profit-making venture. You can't make profits on people's problems. Make profits on all the other things. Make profits on luxury. Make profits on the wants and desires of people, but not on needs. That's the basic of healthcare governance that I think the world should think about. So for a country of 1.3 to 4 billion people, where most of the healthcare infrastructure and professionals are only available in urban setup, whereas 70% of the people who live in semi-urban and rural areas do not have access to the same quality care. What can we do as professionals, as organizations, to make this delivery of healthcare, quality healthcare, affordable healthcare, available to that section of our country, the rural societies? And one problem I would also like to bring to the attention of the global network is that while the government has taken very, very big steps in providing healthcare facilities, a lot of medical colleges have been opened in the recent times, the number of seats have been increased, and government seats means less cost, therefore it's more available opportunities for the children to study. A lot of government district hospitals have been upgraded, and nursing colleges have been opened to create capacity. All this is happening on one side. On the other side, the government, as I say, under the leadership of Pradhan Mantri ji, has also come out with the Ayushman Bharat scheme and many other state schemes which help non-profits like us to deliver healthcare to more and more people. This is happening on one side, no doubt about it. But on the other side, the corporatization also is increasing day by day. And the availability of right kind of specialists and professionals in government setups is decreasing day by day. That is the reason that people are forced to migrate to urban areas or to get the healthcare at the urban hospitals, corporate hospitals. That makes healthcare very, very expensive. Our idea is to create inspiration in the young minds. I think that is something that governments and organizations must think about. And while one common section of the society is that the richer ones can pay for themselves, the most poor, some bit of their subsidies happen, government schemes take care, but there is a huge missing middle. They are neither here nor there. Neither they can pay for their health care in corporate hospitals, nor because they don't have insurances and things like that, or not they're so rich, nor they are so poor that they fall under some scheme. They are the missing middle, they fall into the cracks, and there are close to 40 to 50 crore people in India who, if they fall sick, and God forbid, it's a tertiary care need, they are going to be bankrupt. And once they go bankrupt, the whole family falls apart. Their children cannot get educated, they cannot go to schools. It means it leads to a downward spiral of poverty, deprivation, and more social evils. So unless healthcare is released and freed from the shackles of commercialization, corporatization, and profiteering, no good governance is possible in healthcare sector, in the truest sense. Good governance from balance sheet point of view, from all the rules and regulations and law and order point of view, yes, it can happen. Maybe a little bit of nice patient experience, it can happen. But can it happen in the truest sense? I'm not sure. Unless profiteering goes out of healthcare, it's not possible to have good governance in healthcare. That is our understanding after several years of work in this field. So my appeal to more and more organizations is that please find ways to make healthcare a not-for-profit venture. Make it something that is a service, not a business. And this service means seva, as Srinivasji was telling. When you see everything from the prism of this seva, the whole perspective changes. From transaction, it becomes transformative. And that is the idea of healthcare at our institutions. And I hope we also learn from the discussions that happen, that how this can be replicated, more institutions can be inspired. And this one sustainable development goal of delivering healthcare to everybody, universal healthcare, is achieved in near future and not in too far in the future. This is the premise on which this whole conclave has been organized. And I look forward to everybody coming together, as our scriptures say. Rigveda says, Ano Bhadra Kritvo Yantu Vishwataha. Let noble thoughts come to us from all sides. Let us learn from each other. Let us develop, grow, evolve, and thereby provide solutions to the problems of this world. Definitely there are problems, but there are solutions as well. If the world has so many people who are needy, there are also so many people who are capable of delivering those needs. It's the matter of bridging the gap, bringing the two together, and I think that would be the effort of this conclave. I also am very happy to see many of our students from other medical colleges, nearby hospitals and colleges, staff who have come here, and we look forward to working with all of you to make Chikbalapur, at least the first thing to do is to make the district of Chikbalapur a model district where everybody has access to healthcare and nobody is denied for the want of, as I said, finances, infrastructure, or availability of specialty. I think that is the first thing that we can achieve out of this conclave. And from there we will take it forward. So once again, thank you very much. Praying again as Indians pray. Samasta loka sukhino bhavantu. Let everybody be happy. Not just us, not just the Chikbalapur people, not just the Indians, not just the world, but the entire universe be happy. Let all beings be happy with this prayer. Thanking once again everyone who is a part of this partnership and the eminent people who are there in the audience who are going to share their thoughts. I conclude, and I look forward to having many more such occasions where we can work together to deliver good healthcare with good governance to the last person in the world. Thank you very much.
We will now invite Dr. Somnath Singh, Deputy Director, UNGCNI, to deliver the vote of thanks. Dr. Somnath Singh is a development professional as well as an academic practitioner with over 22 years of demonstrative experience working with different sectors which include government, corporate, civil society organizations, academia, and the United Nations system. With a wide range of expertise in areas such as education, literacy, public health, microfinance, governance, compliance, and city development, amongst others. Dr. Somnath Singh has also been recognized for various initiatives and innovations while working with ministries and national programs of the Government of India and the United Nations agencies like USAID, UNAIDS, UNDP, FHI, and the Union. Dr. Somnath Singh.
Thank you very much, Bhopna. And thank you very much, everyone, because I'm so privileged to be here with the eminent, eminent people sitting on the dais and the audiences who are from different sectors, even the students. So healthcare has always been very close to my heart because I have given more than 18 years in healthcare. So thank you very much. Before, delivering the word of thanks, because this is very challenging task, as I perceive, because the contribution I can't thank, the contribution that healthcare providers is, giving to the society cannot be considered, in few words. So that's why it's very challenging task for me. But before just, delivering vote of thanks for the people who are attending this wonderful workshop, I would like to say a few things about UN Global Compact. When it was formed in 1999, when the mandates were prepared to, work for the community development, to work for the welfare of different sectors, we started, developing and creating awareness on human rights, environment, and labor standard, because that time the problems were being faced on human rights. But in 2003, it was realized, by entire world that there is a problem in every sector that needs attention from all the professionals, all the leaders from different industries, and that is anti-corruption. So in 2003, anti-corruption was included as a important mandate of United Nations Global Compact. So right from that time, UN Global Compact Network India has been putting up lots of efforts to bring changes in the mindset of the people, in the mindset of the leaders, through promoting transparency, good governance, ethical business practices. So thank you very much, Bhuvna. Thank you very much, Prashanti Bala Mandir Trust for collaborating with us, for organizing this wonderful workshop. And I'm really very much happy to see the experts here, to see the healthcare professionals and the would-be professionals. So now I would like to come to my main points, because the co-host and co-organizer Prashanti Bala Mandir Trust has done wonderful job. Even yesterday we had close interaction with the director of the medical college in the morning. We had a good discussion with Guruji, who has the clear vision how we can just strengthen healthcare sector in India. And 3 verticals are there, which is very much important for all the global leaders, that is nutrition, education, and healthcare. So of course, definitely aligning with our agenda of sustainable development goals, we'll put up our proper efforts to bring changes in the policy level as well as the intervention level by all the sectors. So first of all, again, I would like to express my gratitude to this organization and Sri Madhusudan Sai Institute of Medical Science and Research for collaborating with us to co-host today's National Conclave on Good Governance in Healthcare for Global Welfare, and multi-stakeholders workshop on collective action being organized today later. My heartfelt thanks to Sri Madhusudan Guruji, Mrs. Bhuvna, Global Outreach CEO, and the entire team of Prashanti Bala Mandir Trust for their great support and collaboration. We look forward to more effective collaborations in the future to strengthen the healthcare system, ecosystem in India. Thank you very much. And thank you very much, Dr. Subramaniam, for your precious presence and the valuable words that you have told about UN Global Compact Network India and the diverse initiatives on implementing SDG and promoting responsible business practices across the sector in India. Not only the healthcare sector, he has also mentioned a lot of initiative being taken by Government of India, and he is the part of many of those initiatives. So we are so honored, sir, to have you with us today at this first national conclave of United Nations Global Compact Network India and Prashanti Bala Mandir Trust on good governance. We look forward to your continued support for implementing UNGC principles in the future in India. Now, I would like to thank Mr. Ratnesh, my Executive Director, for giving an introductory remarks and setting the context for today's National Conclave on Good Governance and multi-stakeholders workshop on collective action, which is going to take place later. Sir, your encouraging words and insightful direction have set the tone for the program, and it has not only provided us guidance to be stick to the aim of implementing transparency, accountability, and value-based care in India in the healthcare sectors, but also help us understand the importance of collective action for improving and strengthening healthcare sector in India. Thank you very much, sir, for your august presence and nice words. Now, I would like to thank Mr. C. Srinivas, Chairman, Sri Sathya Sai Sanjeevani Hospital, sir. Sir, it has been such an honor for us to be with you at this National Conclave. On behalf of UN Global Compact Network India and Prashanti Bala Mandir Trust, I would like to extend my heartfelt gratitude to you for your gracious presence and wonderful address. We look forward to your continued support and guidance in future. Thank you very much, sir. Because you have, in few words, you have explained the total story of Lord Rama and his, brotherhood with Bharata, how we just, get inspired from them and how we can just implement their motto, the goals to improve the life of the people in India. Thank you very much, sir. Last but not the least, Guruji, please accept my warm regards to you. Your august presence has made this inaugural session of today's National Conclave more meaningful, and it has taught each one of us our real duties for humankind. I take this privilege to share that your entire team is doing a committed and commendable job by serving people in different ways. We, as Global Compact Network India, look forward to your support and guidance and effective collaboration in future. Thank you very much, sir. Thank you, everyone, for being with us. I would like to thank the arrangement team who has been, making all the arrangement for this wonderful workshop since last night. So thank you very much, entire team of Prashanthi Balamandir Trust for arranging everything here, whether it is sitting arrangement, audio, video, visual, everything. Thank you very much. I would like to just, say a few words more because I'm really very much happy to see a huge audience here who just paying their proper attention to listen to us. And therefore, I will request Guruji and Bhavna to please make sure that their presence will be there during our panel discussion, because the speakers who are coming from different places of India, they want to share their, great insights with you, how we can just, strengthen healthcare sector in India. So please be with us throughout the day, so we can just, exchange our knowledge, ideas, and insights to strengthen healthcare sector in India. Thank you very much, everyone. Thank you, Bhuvna. Thank you.
Thank you very much, Dr. Somnath Singh. Yes, rest assured, we will all be here soon after lunch. We will be breaking for lunch in just a little bit, and we will all be here, like you said, Dr. Singh, to collectively come together and work towards good governance and see how we can all inspire each other to serve the society in a better way. We thank all our dignitaries who've taken time out to be with us today, and our special thanks to our guest of honor, and we would like to extend our love and gratitude to you, sir. Thank you, everyone. We will now take a short lunch break and reconvene at 1 p.m. for the next session. Thank you very much.